They are so handy, they are prepared in no time. I get it. It's very easy for them to be utilized, and this is not really advisable by many physicians, and I am also not in favor of advising anybody on a very low caloric diet because do you think that only the diet can reverse the diabetes? Well, the answer is yes. In this video, we are going to talk about what are the diets that have proven to reverse the diabetes mellitus, and what are the glycemic index of each diet, and what is the caloric value with different ingredients and different types of foods. So the first thing first is that can the diabetes be reversed? So let's see some of the evidence. So the evidence says that the low carbohydrate diet, and it was published in Diabetes Care 2021. In 6 months' time, there was almost 60% chance improvement of the diabetic control along with diabetic reversal. Now, this needs to be coupled with the exercise and lifestyle modification. And these are generally the patients of type 2 diabetes mellitus, not really advanced in their disease. So the 60% improvement of the diabetes or the BSL control was achieved just by the low carbohydrate diet. And I'm going to, this is just an index video, and I'm going to talk about different types of diets, including the low carbohydrate diet and the different diets that I'm going to name in the subsequent things. For you, if you are interested in any typical type of diet, please mention in the comment section, and I'll try to work on it and start the video from there in the subsequent section. Then is the intermittent fasting. Intermittent fasting is known to be effective, and it has proven to be curative in terms of treatment of diabetes mellitus. And this, it was published in Cell Metabolism 2022, and there was also almost 55% to 60% reduction of the blood sugar level. And if the intermittent fasting was continued for 4 to 8 months. Now that's quite a long time for intermittent fasting, but achieving almost more than half of the control of the diabetes, it's better. And many of these people totally reverse the diabetes just by only doing the intermittent fasting, but all of them were also doing some additional lifestyle modifications too. Then the plant-based diet is also advocated, and it was published in JAMA in 2023. Almost 40% chances that plant-based diet, sticking to it, can reduce the diabetes and may be able to reverse it even. So the next diet is the world famous ketogenic diet. The ketogenic diet has almost 65% chances of curing diabetes mellitus in 6 to 8 months. And this was reported in Nutrients 2020. The thing is, ketogenic diet has a lot of detail, and you need to be vigilant for the fact that there are few things in which you must be very careful, especially if you're a uric acid patient or a gout patient. Then ketogenic diet may be counterproductive in your case. I'll talk about that in the video when I talk about the ketogenic diet. The next diet is the very low caloric diet, and this is not really advisable by many physicians, and I am also not in favor of advising anybody on a very low caloric diet because there are so many other side effects of it. So one should be staying close to the nature, and too much of an extreme of anything is not good. But the data says that it's very effective in curing diabetes mellitus, and Diabetes UK study has proven that. Exercise alone has only 20% chances of curing diabetes. Now that's a very low number, but when you add this to one of the diets that we have just discussed, now additive number is quite enormous. You have almost 80% chance of curing diabetes if the diabetes mellitus is type 2 and it is in the initial phase and the beta cells haven't exhausted. So these curing, when we talk about the cure of diabetes, this cure is not for everybody. Type 1 diabetic patients won't be benefiting from it, and on the other hand, if the type 2 diabetic patients have been having diabetes for the last 20 years, and now they need an insulin in addition to the drugs that they have been using previously. This reversal may not be there, but there will be a definite improvement if they do the kind of diets that we have discussed. So now I'll talk about the few foods, and we'll talk about the glycemic index, and few of them will be highlighted about caloric intake too. So the green leafy vegetables, they have a low sugar, of course, and the glycemic index is only 15. On the other hand, nuts and almonds, they have a glycemic index of something like 20. Cinnamon has a glycemic index of 5. Eggs, almost none of the glycemic index is available, but the calories are 155 kilocalories. That's a huge number. On the other hand, let's flip the picture. So, which are the drugs which are having too much of the caloric intake and along with that a high glycemic index? White bread. A rapid sugar rise is there and the glycemic index is almost 85. That's a huge number. Fruit juices, which are considered to be the best, most healthy, there is no side effect, but thing is the glycemic index is 70 to 75 kilocalorie. Although the relatively calories are kind of low, but it goes without saying that the fruits are also ultimately sugar. So too much of the sugars cannot be justified, and they should not be advocated as a sole therapy or the sole modality of food. Now, French fries, the famous ones, these are having a glycemic index of 75 and a calorie of 312. That's a huge number, and we generally don't even count those calories when we are taking some fast food. Now, the pastries and the cake are having a glycemic index of 90 and a calorie of 400. Instant noodles, the one that we use so often for our kids and the next generation, it's having a glycemic index of almost 70 and a caloric index of 480 kilocalorie. That's a huge number. I'm never in favor of these instant noodles. They are so handy, they are prepared in no time. I get it. It's very easy for them to be utilized and without any labor intensive effort, but they are not good in any dimension. Now, you need to go to the dietitian to exactly make your diet plan, but in general, low calorie diet, if you are planning, probably you should be targeting a caloric intake of something like 1200 to 1500. A plant-based diet with a caloric intake of 1400 to 1600, and intermittent fasting, well, I'll talk about the intermittent fasting when I make a complete video on it, and I'll talk about which patient should be fasting in which way. Everybody should not be doing the same kinds of intermittent fasting. Everybody is different in terms of their comorbidities, other diseases, age, gender. The ketogenic diet should be targeting a caloric intake of 1000 to 1300, and a very low caloric diet is below 1000, which I generally don't advise. But these last few caloric targets, these are known and proven to be helpful in curing the diabetes mellitus, provided it's type 2, early, and the disease has not gone to the extent that the beta cells are totally exhausted and there isn't any insulin within the body to begin with. Because in that case, when the type 2 diabetes mellitus becomes insulin dependent after a few years, it's generally not feasible for it to completely cure. Though with the help of these diets, you can reduce the number of medicine, you can reduce the number of units of insulin that you have been using, and the more the number of insulin units that you are using, there is increased chance for you to be getting overweight with that. And there is an increased chance of more triglycerides within your blood if you're using too much of insulin. I'm not advocating that you should be changing the number of the units of insulin. It must be done by your physician or the specialist. You should never change anything in your prescription on the basis of whatever you hear from me or anybody else. Your medicine, your treatment must be tailored by the physician and the specialist that you are consulting with. These videos are just meant for educational purpose and educational purpose only. So that's about it, and please do mention in the comment section that which kind of diet and which kind of fasting are you most interested in, so that I can focus on what you need. And this is not a huge channel at this point in time, so I want to give the maximum value for the viewers that are already coming to this channel to get some answers to their health topics. Stay safe, stay healthy, stay strong. Thank you.